Hi everyone, Dr. Celestine here. Now, I wanted to talk a little bit today about some of these weight loss medications and how we're seeing increased fertility with them as a kind of unexpected side effect. Now, I'm obviously not a weight loss doctor or specialist. I am an OBGYN, so I see the unexpected pregnancies or the surprise pregnancies where people thought they couldn't get pregnant on their own, and that's because they're taking some of these newer or these weight loss medications rather. Now, to be very clear, these medications are not for fertility. They are not for getting pregnant. We are just seeing that as a side effect, and I want to talk about why. So the ones I'm talking about in specifics are the GLP-1 medications, so the glucagon-like receptor agonist medications, like the Ozempics that have become more popularized recently, Mounjaro, Zepbound, also Trulicity, things like that. So these medications, their indications are for obesity, for diabetes, sometimes for sleep apnea, again, not for pregnancy, not for fertility. These medications, the reason why this is happening, let's talk about a few of these reasons. So one is inherently just the weight loss. So the higher you go in weight, your chances of fertility decrease. Some people have actually studied this and shown that if you want to use BMI, that each point above 29 in terms of your BMI increases your chance of or decreases your chance of fertility by about 3 to 5%. And that's because what I talk about with my patients is fat cells actually disrupt estrogen, can make you also more insulin resistant, especially if you have PCOS, things like that. So that is what is decreasing your chances of fertility. For men, obesity is actually linked to decreased sperm health. So it decreases the quality of the sperm. So it affects men as well when it comes to fertility. If you were taking these medications for diabetes, elevated blood sugar can increase and affect your insulin levels, which actually affects a female hormone called LH, or luteinizing hormone, which is part of the process for egg maturation in your ovaries, as well as for ovulation, which is releasing that egg every month in order to get pregnant. And if you are someone that's not trying to get pregnant, you're on birth controls, these medications actually decrease absorption of oral birth control pills. So to prevent pregnancy while you're on these medications, we talk about switching birth control sometimes to an IUD that sits in your uterus or a Nexplanon that goes in your arm, for example, because you don't want to take the oral birth control that gets decreased in effectiveness, especially during the rapid weight loss phases or, specifically the times when you're increasing your doses as you're taking the medication over time, the GLP-1s. So this is why we are seeing the Ozempic babies. This is why we are seeing increased fertility in some people that are on these for other indications. But to be clear, if you're trying to get pregnant, you do not take these medications while you're trying to conceive. Some research has shown stopping it for at least 2 months before, but all in all, the research is not really there yet. We don't know how safe these medications are in pregnancy, which is why overall most doctors are recommending not even to be on it close to trying to conceive or while you're pregnant or while you're breastfeeding. So yeah, that's why we are seeing increased fertility in people that are taking these GLP-1 medications.